Hello, I am the AI version of Dr. Andrew Guto, an orthopedic hand surgeon in Palo Alto, and I'm going to talk to you today about a common hand disorder, trigger fingers. Patients with trigger fingers note catching and stiffness and popping and pain of a finger or a thumb as they bend or straighten the finger. Most commonly, patients will tell me that when they make a fist or bend their thumb down, they have trouble straightening the finger out, and they feel as if their finger is locked. They tell me that it pops or catches as they open it, or they need to use their other hand to uncurl the finger. Many patients described that the symptoms are more severe when they first wake up in the morning, and better over the course of the day as they move the finger more. Trigger fingers are due to a problem with the tendon which bends the finger. The tendon runs from a muscle in the forearm, through the wrist, to the tip of the finger. The tendon is like a rope running through a series of small sheaths or pulleys, like fishing line goes through the eyelets on a fishing rod. The tendon and the surrounding synovium around the tendon become swollen up, so that as the tendon enters into the finger, it is larger than it should be, and it gets caught in the pulley sheath. This swelling can be due to mechanical trauma from overuse with a strong or repetitive grasp, such as with a golf or weight training or tool use. It can also occur from a single injury. It can be caused by systemic disease, such as the elevated blood sugars of diabetes, or in thyroid disease, or from inflammatory processes, such as rheumatoid arthritis. Like other tendon disorders, it can also occur in pregnancy. Rarely it can be due to amyloid protein deposition. In many patients, it occurs without clear cause. Once the finger starts to trigger or catch, the process can be self-aggravating, with the tendon being more irritated each time it catches. In cases of overuse caused trigger fingers, sometimes the only treatment needed is modification of activities with avoidance of the bothersome activity. If the finger is getting caught at nighttime, then use of a splint to rest the finger and hold it straight at night can be helpful. A short period of daytime splinting for a few weeks can also be helpful, as long as the finger is not splinted for so long a time that it gets stiff. A splint such as the Vive brand trigger finger splint that only blocks motion of the first joint of the finger closest to the hand is a good choice for a splint. Passive stretching of the finger using the other hand to extend all the joints of the affected finger can be done a few times. In cases where these methods do not work, or where the pain and catching of the finger is bothersome or limiting motion, additional treatment can be to do an injection of cortisone in the office. With a single injection, about 2 out of 3 trigger fingers are made better. Cortisone is a steroid which decreases inflammation and thus works by decreasing the swelling of the tendon. I use a steroid called Celestone, which is a mixture of betamethasone, acetate, and phosphate. To decrease the pain of injection, I freeze the skin prior to injection and combine the cortisone with a local anesthetic called lidocaine. The injection can take up to a week to give benefit. In some cases, the pain resolves prior to the catching. If the injection is not helpful, or if the triggering recurs, a second injection can be given after 6 weeks. After 2 injections, the likelihood of successful treatment with an injection decreases to less than 40%, and usually no more than 3 injections should be given within a single year. If activity modification, splinting and stretching and cortisone injection do not resolve a trigger finger, then I can perform a surgical release of the tendon sheath where the catching is occurring in the palm. The surgery can be performed using local anesthesia similar to that used for a dental procedure. There is a high success rate of over 95% in fixing the triggering. However, there can be complications, as with any surgery, and there can be pain and discomfort at the site of the incision in the palm over the area of tendon release. Patients need to keep the incision covered and clean and dry for 3 to 5 days after surgery before getting it wet. Some patients need the assistance of a hand therapist after surgery to regain motion, help with surgical incision pain and swelling, and to get back best function. In summary, trigger fingers are a common disorder which can often be successfully treated with activity changes and injections. But in those cases where such treatments fail, there is a highly successful surgical treatment.